Global health continues to be a critical area of concern as new threats emerge and existing challenges persist. The landscape of global health is shaped by an intricate interplay of infectious diseases, vaccine distribution challenges, and evolving international health policy responses. Among the most pressing issues in 2024 are the ongoing outbreaks of various diseases, with a particular focus on the resurgence of monkeypox, which has raised alarms within the World Health Organization, WHO, and the global health community. This analysis will delve into the latest updates on these emerging global health threats, exploring the intricacies of disease outbreaks, the status of vaccine distribution, and the responses of international health authorities. Monkeypox outbreak, a renewed global threat. Monkeypox, once a relatively obscure virus confined to certain regions in Central and West Africa, has re-emerged as a significant global health threat. The virus, which is related to the smallpox virus, causes symptoms similar to smallpox, though generally less severe. It is characterized by fever, rash, and swollen lymph nodes, and in severe cases, can lead to complications such as secondary infections, respiratory distress, and even death. The current outbreak, which began in 2022, has been unusual in both its scope and its pattern of transmission. Unlike previous outbreaks, which were largely contained within rural areas of Africa, the recent wave has seen cases reported in dozens of countries across multiple continents. This includes nations in Europe, North America, Asia, and Latin America, regions where monkeypox had previously been rare or unknown. The spread of monkeypox in non-endemic regions has been driven by several factors. Increased global travel, urbanization, and interactions between humans and wildlife have created new opportunities for the virus to jump from animals to humans. Additionally, the waning immunity against smallpox, due to the cessation of routine smallpox vaccinations following the disease's eradication, has left populations more vulnerable to monkeypox. The World Health Organization, WHO, has expressed deep concern over the outbreak, labeling it a public health emergency of international concern, PHEIC. This designation underscores the seriousness of the situation and calls for a coordinated international response. The WHO has been working closely with affected countries to monitor the spread of the virus, provide guidance on containment measures, and support the development and distribution of vaccines. Vaccine distribution and challenges. One of the key components of the global response to the monkeypox outbreak has been the development and distribution of vaccines. Vaccination is seen as a crucial tool in controlling the spread of the virus, especially in regions where it has recently emerged. However, the distribution of vaccines has faced several challenges. Firstly, the supply of vaccines has been limited. While vaccines developed for smallpox, such as the modified Vaccinia Ankara (MVA) vaccine, have shown efficacy against monkeypox, the production capacity for these vaccines is not sufficient to meet global demand. This has led to competition among countries to secure limited supplies, with wealthier nations often having an advantage in accessing vaccines. Secondly, there are logistical challenges associated with vaccine distribution. The MVA vaccine requires storage at low temperatures, which can be difficult to maintain in remote or resource-limited settings. Additionally, reaching populations in rural or conflict-affected areas presents significant obstacles, both in terms of infrastructure and security. Efforts are underway to ramp up vaccine production and improve distribution channels. The WHO, along with other international organizations, has called for equitable access to vaccines, emphasizing the need to prioritize vulnerable populations and healthcare workers. Some countries have also initiated domestic production of vaccines to reduce dependence on external suppliers. Other emerging health threats. While monkeypox has garnered significant attention, it is not the only emerging global health threat. The world continues to grapple with outbreaks of other infectious diseases, some of which have the potential to cause widespread harm if not effectively contained. One such disease is the resurgence of Ebola in parts of Africa. The Democratic Republic of the Congo, DRC, has reported new cases of Ebola, raising concerns about the virus's potential to spread to neighboring countries. The WHO and regional health authorities have responded with swift containment measures, including vaccination campaigns and public health education. However, the ongoing conflict in the region has complicated these efforts, making it difficult to reach affected communities and track the spread of the virus. In addition to Ebola, there have been outbreaks of other viral hemorrhagic fevers, such as Lassa fever and Marburg virus disease. These diseases, like Ebola, are highly contagious and have high mortality rates, making them a significant concern for global health. The emergence of these diseases in new regions highlights the need for continuous surveillance and the strengthening of health systems to detect and respond to outbreaks promptly. Another area of concern is the spread of antibiotic-resistant bacteria, often referred to as superbugs. The overuse and misuse of antibiotics in both human medicine and agriculture have led to the development of strains of bacteria that are resistant to multiple antibiotics. This has made treating common infections increasingly difficult and has led to a rise in mortality rates from diseases that were once easily treatable. The WHO has identified antimicrobial resistance, AMRA, as one of the top global health threats, and efforts are being made to promote the responsible use of antibiotics, develop new treatments, and enhance infection prevention and control measures. International health policy responses. The emergence of these global health threats has prompted a re-evaluation of international health policies and the mechanisms in place to respond to outbreaks. The COVID-19 pandemic, which continues to affect many parts of the world, has exposed weaknesses in global health systems and underscored the importance of preparedness and cooperation. In response to these challenges, there have been calls for reforming the WHO to enhance its ability to respond to health emergencies. Proposals include increasing funding for the organization, improving coordination between member states, and establishing a more robust system for monitoring and responding to potential outbreaks. The WHO has also been working to strengthen its partnerships with other international organizations, such as the World Bank and the United Nations, to ensure a more integrated approach to global health. Another key focus of international health policy has been the development of a global health treaty. This proposed treaty would establish a framework for cooperation on health issues, including the sharing of information, resources, and technology during pandemics. The idea has gained traction in the wake of the COVID-19 pandemic, with many countries recognizing the need for a more coordinated and equitable approach to global health. The role of the G20 in global health governance has also been highlighted, with the group committing to support the global response to health emergencies. This includes providing financial support to low-income countries, ensuring access to vaccines and treatments, and promoting research and development in health. The G20 has also emphasized the importance of building resilient health systems that can withstand future shocks, including pandemics and other health crises. The landscape of global health is rapidly evolving, with new threats emerging alongside persistent challenges. The ongoing monkeypox outbreak has brought renewed attention to the need for robust global health systems and equitable access to vaccines and treatments. While progress has been made in addressing this and other emerging health threats, significant challenges remain, including vaccine distribution, logistical barriers, and the need for international cooperation. The response to these global health threats will require a multifaceted approach, involving not only the WHO and other international organizations but also national governments, the private sector, and civil society. Strengthening global health governance, improving preparedness and response mechanisms, and ensuring that all countries have the resources and capabilities to protect their populations will be crucial in addressing the health challenges of the 21st century. As the world continues to grapple with the ongoing monkeypox outbreak and other emerging threats, the importance of global solidarity and cooperation cannot be overstated. The lessons learned from recent outbreaks, including the COVID-19 pandemic, must inform future actions to build a safer, healthier, and more resilient world. The international community must continue to work together to address these challenges, ensuring that no country is left behind in the fight against emerging global health threats.
Well, thank you so much for watching, and please don't forget to hit the like button.